Hello, everybody.
Hi, Senna. Long time no see.
I know, Katina, what's going on? I mean, we can't go this long without seeing each other again.
I know, right?
Oh my goodness. Gosh, this is exciting. We haven't had, this many visitors in a long time for our actual meeting. This is wonderful. This is like the old days. It's so good to see everybody. We'll give everybody a few more minutes to log in. It's only 4:01.
I said it's nice that the weather's turning.
Isn't it lovely? It's so
Yeah. I'm a little under the weather, so if I may leave it sometime because I may be getting tired. I don't know. I think it's my sinuses.
Oh, well, I'm sorry to hear that.
Yeah.
We're zooming you some healing energy and love.
Good.
Right?
Yeah. Well, hopefully it'll work.
Yes.
Okay,
we are believing that it will.
So
Yeah.
we have 11 folks. So I think, we have enough to go ahead and get started. I would just remind the trustees in particular that please keep your cameras on. And if you are leaving the meeting early, if you could put in the chat to Morgan that you are leaving the meeting so that we can account for the vote. And also to all the visitors, if you would be so kind to write your name in the chat and the agency or system you represent. That is the way we'll do our digital sign in. I'd appreciate that very much. And with that said, I'll just turn it back to you.
Oh, well, thank you, Scott, for that. And I'd like to call the meeting to order and ask Morgan to roll call, if you will, darling.
Ms. Friedman.
Here.
Mr. Arnold. Ms. Banks.
Here.
Ms. Bell.
Here.
Mr. Brown.
Present.
Ms. Carter.
Here.
Mr. Janide.
Here.
Reverend Gordon.
Here.
Ms. Harding.
Here.
Ms. Howe.
Here.
Ms. Mendoza-Locke.
Here.
Mr. Knowles. Mr. Knowles. Mr. O'Connor. Mr. O'Connor. Ms. Rodriguez.
Here.
Mr. O'Connor, was that you? Dr. Russell.
Here.
Mr. Stengel.
Here.
Mr. Tiggs. And Major White.
Here.
Thank you.
Yeah, thank you so much, Morgan. I also noticed that towards the end of your roll call, Mr. Knowles did log in.
Thank you.
You're welcome. Next, oh, wow. The next one, I'm not sure how we're going to handle, Scott. This is the first time we've had this many visitors on a Zoom meeting.
We did the recognition of visitors in the chat.
Oh, okay. Well, then moving right along, I'd like to ask for a motion to approve the minutes.
Motion.
Second.
Thank you.
Can we have a consent agenda that we're using?
Okay, so just,
Oh.
okay,
Right, so we need to determine the consent agenda. I think what you meant to ask is, do you want to leave the minutes on the consent agenda, not
yes,
make a motion for the vote?
yeah. Thank you, Scott. Do we want to leave the minutes on the consent agenda? Or even a better question, is there anything that we want to remove from the consent agenda?
No, and I'll make a motion to approve, right?
Yeah, the consent agenda.
Second. Who's Nima?
Oh, thank you, Nima. All right, then, with any conversation, any questions, any regarding anything? Okay, moving forward then, we're going to move forward and ask Morgan to do roll call.
Miss Banks,
Yes.
Miss Bell,
Yes.
Mr. Brown,
Yes.
Miss Carter,
Yes.
Mr. Janide,
Yes.
Reverend Gordon,
Yes.
Miss Harding,
Yes.
Miss Howe, Miss Howe, Miss Mendoza Locke,
Yes.
Mr. Knowles,
Yes.
Miss Rodriguez,
Yes.
Dr. Russell,
Yes.
Mr. Stengel,
Yes.
and Major White.
Yes.
Thank you.
Thank you, everyone. Next, I believe we're going to, Scott, we're going to Amy
Yes,
for our health officer designation.
Thanks, Senna. Hi, everyone. If you're following along in the board packet, I'm on page 42, the very last thing in the packet, the second half of the page. We just have two health officer renewals listed here that were approved by our health officer advisory committee. They're both at Zeph Center. There's a motion there towards the bottom of page 42, and I'm happy to answer any questions if anyone has any.
Any questions for Amy? Hearing none, we'll go ahead and move forward, and I'll ask for a motion.
So moved.
Thank you.
Second.
Thank you, Tricia. Morgan?
Miss Banks. Oh, sorry.
Yes.
Miss Bell,
Yes.
Mr. Brown,
Yes.
Miss Carter,
Yes.
Mr. Janide,
Yes.
Reverend Gordon,
Yes.
Miss Harding,
Yes.
Miss Howe,
Yes.
Miss Mendoza Locke,
Yes.
Mr. Knowles,
Yes.
Miss Rodriguez,
Yes.
Dr. Russell,
Yes.
Mr. Stengel,
Yes.
and Major White.
Yes.
Thank you.
Thank you, everybody. I believe now Scott will be moving to open session. Awesome, and I will be, am I turning the floor over to him? This is my first one, so.
we need to know if within this meeting's open session, if anybody wants to say anything before we adjourn the meeting and go into the forum.
Got it. Perfect. Thank you very much for your guidance there, Scott. Do any of our visitors have anything to report to the board or would like to share with the board prior to us adjourning? I can't see everyone, so I'm going to have to rely on Um, let's see.
Son, I don't see any hands up, and I don't
Okay.
see anybody making any motions to speak.
Okay, thank you. Do I have a motion to adjourn? Yes, let's do it. Okay.
So moved.
So moved.
We're okay. Thank you.
Second.
We're adjourned. Pretend I have my little mallet. Let's go.
Okay, everybody. What do you say we just roll with it? All right. It was a bit awkward for us. We've never done the conjunction of it. Well, we haven't done the full trustee meeting in quite a while virtually, plus rolling into our forum. So we appreciate your patience in that. You know, our forum today, we have 16 speakers. I want to remind you that we have each speaker has 5 minutes. Within the as you're getting to the end of your 5 minutes, we do have a timer, and our timer will personally send you a chat at 4 minutes. So as you're speaking, please look at your chat, and if a new one pops up, you know you're getting close to your time. We'd like to keep this moving. I will be introducing speakers 2 at a time. Usually, for instance, the first 2 speakers, Miss Flores, if she is here. I haven't seen her quite yet. And
I'm speaking on her behalf, Scott.
oh, thanks, Ursula. All right. And then Miss Hare is on deck. So we'll do it like that, and we'll keep everything moving nice and smoothly. In the end, I'm sure we will open it up for anybody else who might want to make a comment. Also, I would remind everybody to please keep, unless you are speaking, please keep on mute. I will just maybe turn it over to Senna real quick with some opening comments.
Thank you, Scott. Good evening and welcome, everyone. We as a board really look forward to our annual stakeholders forum. Why do we look forward to it? It's really quite simple for us. It's because we get to hear from you, and we get to hear how we can better serve you and your clients. What gaps are we missing in our community in terms of services? And we get to hear about the trending issues, you know, the things that are keeping you up at night. We are here to listen and excited to do so. So thank you for all that you've done to prepare for this afternoon. I know that it's difficult when you're given 5 minutes to talk about all these different issues, but and then submitting them in writing prior. So I really want you to know how much we as a board appreciate you taking the time and doing all the preparation and then being here this afternoon. Thank you. Back to you, Scott.
Thank you, Senna. So why don't we go ahead and proceed? We have Ursula Barrera speaking on behalf of Zepf Center in place of Ms. Flores, and then Lynette Hare will be on deck. Ursula, go ahead.
Thank you, Scott, and the board for allowing us to speak today. I'm speaking on behalf of Deb Flores, CEO of Zepf Center. My name is Ursula Barrera Richards, and I'm the Chief HR Officer. So I will get right into our testimony. Zepf Center, over the past 46 years, has been committed to serving the needs of our community's most high-risk and high-needs patients. We believe that to achieve our mission and to create hope and recovery through integrated services, we must invest in a full spectrum of care for our patients, even when some of those services are provided at a financial loss to us. Today, we want to emphasize 4 critical areas that are currently impacting our ability to serve our clients. That includes staffing shortages and retention, increased needs for our services, housing shortages, and reimbursement challenges. To the point of staffing expectations and retention, access to services is the first step to treatment. Zepf Center strives to meet the community's needs by providing both scheduled intake appointments as well as a walk-in clinic. We also provide 24/7 admissions to withdrawal management services as a response to the opioid crisis. Open access requires hire independently licensed staff for our 24/7 assessments. that can cover cost of $250,000 annually for 3 RN coordinators, security, as well as the additional staff needed to do this. Currently, we are taking a loss because funding omits all costs not associated with providing the services. If we are to continue offering 24/7 assessments, we would need grant funding to supplement the fee-for-service billing. In addition to meeting the higher accessibility expectations, retaining staff at current wages is financially difficult due to rising inflation. Zeph Center is performing better than some other healthcare organizations in retaining staff. However, the lower wages in healthcare is being overshadowed by other entry-level services such as service industry. Next, the increased need for services. In 2019, 20% of the US population was diagnosed with a mental health disorder. As you know, the rates have grown over the last few years due to the pandemic. According to HEDIS data in 2020, Medicaid patients who were in a psychiatric hospitalization received timely follow-up appointments 39.4% of the time. Meanwhile, in 2021, Zeph Center completed this service 62.85% of the time. However, to meet this timely, high-quality service, the agency's expenses are higher than our revenue. For example, Zeph Center works to engage patients for follow-up with our hospital discharge clinic, offered every Monday. Further, the hospitals schedule an average of 20 new patients with us weekly, yet only an average of 5 patients make it to the appointment. There's no mechanism to bill for this time spent with follow-up patients. Zeph recognizes the importance of this service because our data indicates a low percentage of our patients are being readmitted to the hospital within 30 days of discharge, which is saving the system money and improving the patient's quality of life. We do this because that's the right thing to do for our patients and the community, not because we earn a profit. In fact, it's the opposite. Next is housing shortages. Housing is an important component of the recovery process. Without stable housing, many individuals are unable to maintain compliance with treatment interventions and services. Because of this, Zeph Center offers both recovery housing and supportive housing to individuals in need, with the majority of the residences providing 24/7 staffing. All housing programs are underfunded, and currently billing mechanisms fail to include food and indirect staff costs. Lucas County housing shortages was revealed in a United Way analysis prior to the fall season. And that is attached in the testimony for those who have a hard copy. The information is timely and accurate. The number of 211 calls requesting assistance with housing would indicate that people are in greater need of housing assistance. Even though Zeph offers housing options, SOAR funding is limited, and we need a long-term sustainable solution for those in short and long-term recovery. Reimbursement challenges are also a great need. Since Health Home ended, then we had COVID, behavioral healthcare coordination ended in 2020, the cost to search for patients missing appointments is not reimbursed. Those who qualify for Medicaid are living in poverty, typically also have severe and persistent mental illness. Those patients are often challenging to serve due to situations such as homelessness, lack of transportation, missed opportunities, health risks, hospitalizations, and other issues our staff are trained to help navigate. The care coordination services are essential to maintaining the continuum of care for our mental health services. We are experiencing a net loss in 17 out of 52 cost centers or programs. Only 4 of our cost centers are in a net gain. While the financial problem of Zeph Center and other behavioral health providers in Lucas County may not be the direct concern of this board, it is a concern for the community as a whole. If Zeph Center cuts programs that the community has relied on, then we will have a serious deficiency in lack of service delivery. We then illustrated 4 ways that we can have help from the board with these systemic issues. I'm over my 5 minutes, but I'll just go through them really quickly. Employment challenges, we've illustrated some issues we have that we could use your help with that. Community collaboration assistance, advocacy, and making data-driven decisions. So given the financial state of Zeph Center and feedback we've gathered from other local behavioral health providers, we know the environmental challenges are quite a difficulty for our community. So we're hoping we can work together to address these underlying conditions and assure services can be maintained for those that this board and Zeph Center both strive to serve. Thank you for your time today.
Thank you, Ursula. Appreciate the comments. I think it's appropriate I also mention that for those of you who may want to submit written comments or have submitted written comments, it's very much appreciated. If you want to go ahead and send written comments or perhaps the testimony that you're providing, I will go ahead and put my email in the chat and you can just send that over to me. So what do you say we proceed with Ms. Hare and her 5 minutes, and on deck is Judge Tim Coleman.
Yeah. Okay, thank you, Scott. I'm Lynette Hare, the Executive Director of Neighborhood Properties. I will be sending the written statements along with data, but I won't report out on the data at this time. What we found that a way to improve the continuum of care and what is missing, we are having our street outreach path program having difficulties finding shelter beds for persons that they engage and work with. We are finding a greater challenge to have diagnostic assessments done quickly for those who are homeless. We also feel that there's a need for a community needs assessment of the group home system. What is the adequate number of beds needed out there? How do we recruit additional providers? We are finding that a significant amount of our providers are aging up there and looking to retire from the system. And we also would like for a pulse check of our coordinated entry system to effectively look at that from the perspective of the homelessness providers, along with how can we improve from the perspective of those clients who have engaged and been serviced by this system. Ways that the mental health board can assist in addressing some of our challenges we're looking at. We are looking at the challenge of rental assistance, needing an increase in those dollars. As we look at the community, fair market rents have increased. We've had HUD programs increase to reflect fair market rents. However, our assistance and subsidy dollars haven't necessarily historically increased with fair market rents. Ways that the board can support youth. We are finding that in our families program that our kids are behind in schooling. So support in after school programming and tutoring, incentive programs to help those that are older youth find employment, and also mentoring opportunities and potentially peer-to-peer youth initiatives. Trends that we are seeing in our workforce is that with the housing first model, we are seeing some staff burnout in terms of our folks are in our homelessness system are coming with layers of traumas that's making an impact on our staff and their housing stability. So finding support and enriching our programs to address those issues and having the needed assistance for our clients to maintain housing, be successful in their housing. We really haven't experienced challenges with serving those with language barriers. The destruction to our units have been increased need that we are seeing. The costs to rehab our units and get those units turned over have increased significantly. And also with the economy and the shortage of, at times, of building supplies and materials, that has been a challenge for us. Biggest barrier that staff identified with our clients completing treatment is that turnover of staff at community mental health systems for challenges to their staffing. I think that Zeph had brought up some points about that. We would like to see a shorter wait time between appointments for persons to get prescriptions and medication management. The delay we see with diagnostic assessments, and from the point of diagnostic assessment appointments to getting into enrollment of treatment services, we see a too long of a delay there. And we also see that clients themselves lack, I'll use for a term, lack motivation. And the context I'm saying that in is in that during the pandemic, we've seen clients that did not have the services they had prior with the in-person treatment services. And we have found that clients are feeling like I made it on my own. I'm going to be okay. I've endured the pandemic. And we find that if they've fallen out of services, they are not so quick to get back into services. So that's been a challenge. We see as a training need for the agency, we have began the trauma-informed care training due to investments from the Mental Health Board. One of the things that we do have a concern, and this may just be internally, but as a community, maybe there's some feedback on it. How, as a community, as we're getting trauma-informed, do we keep the momentum going, that it's not just when it's done, it's done. We've done 2 years of investment into the process. We've implemented it in writing into policies, procedures. How do we keep going as a system with the trauma-informed care? And I'm not sure how many minutes that is. I went pretty quickly to get all the points.
That was it. I didn't want to interrupt, but that was it.
Okay, all right.
It's hurting me to do this to everyone.
All right. Thank you.
Okay, so we're going to need a little bit more proactive engagement when your time runs over. But thank you, Lynette. We appreciate your comments.
All right.
Our next speaker is Judge Timothy Coleman, and Julie Kukuthi is on deck. Judge?
Thank you, Scott. Judge Tim Coleman from Toledo Municipal Court. I want to start with thanking the board and Scott for a number of things, and then identify 2 areas that we have concerns in. The first thing I want to thank for is in the past, I've been a judge for 17 years, and when I started, there was kind of an attitude with mental health that we work with the mental health people and you work with the criminals, and we'll decide. Some are on this side of the line and others are on that side. That is not the attitude anymore, and we really appreciate that. And I think our community is better for it, and the people that we serve are better for that. So this strong partnership between mental health and criminal justice is very important. So the first thing I want to thank for is funding the Behavioral Health Criminal Justice Coordinator, who is housed at the Criminal Justice Coordinating Council, Lindsay Simzik. So she is a person whose job is to reach out to judges, courts, public defender's office, prosecutor, jails, and police departments, and coordinate with Harbor, Zeph, Unison, NPI, and everybody else who's offering mental health. As an example, Lindsay coordinated a lunch today with police, sheriff, me, public defender, and common police court to discuss kind of to share ideas about what we wanted to talk to you about, so that we kind of have a coordinated and reasonable discussion with you guys. So thank you for that. A couple of other new programs that I think are going to be very, very important and unbelievably helpful for us in our community is the new Unison program at the jail, where people are actually getting treatment within the jail. That is going to help us immensely. And also the new Zeph drop-off center. So police, when they have somebody who really has a mental health, drug, alcohol issue that is not a public safety issue, they have someplace besides jail. So that person gets help instead of being locked up. And of course, our Opportunity Project, I think you're going to hear from Dan Huseman and also Sean McNulty from the Public Defender's Office about those programs that are really helpful to what we are trying to do at Toledo Municipal Court, and also Common Police. So thank you for that cooperation, those assistance for those programs. Our 2 biggest issues that our judges are concerned about right now include housing, which has already been mentioned, I think, by everybody so far, and we share those concerns. If we have somebody who is homeless or does not have stable housing, or maybe even just not sober housing, all the treatment in the world seems to not be all that successful. And so everybody's talking about that, and we share that concern. My specific concern, and I did forward, Scott, you some statistics on this, is we have a really big problem with getting competency referrals back in a timely fashion. And then for those people who are who are not competent and need restored, we really don't have great access to NOPH or any other restoration. So in looking at our 2021 competency referrals, if we have somebody in custody, we have a state law speedy trial that says we can hold only 30 days. So we have to be done with everything in 30 days. There is a tolling for that when we're waiting for competency. But in 2021, our competency referrals took 31 to 86 days just to get the report back to tell us whether people were competent or not competent. So far in 2021, our longest one is 60 days, and there's several reports where we referred back in January. We don't have those reports back yet. Now, CDTC has a problem with staffing, which I've also heard others say, and we recognize that. We've had conversations with them, and they are making lots of efforts to get more people on board. We understand that, but I want to make clear that that's a problem.
Judge, you have 1 minute.
Thank you. So I think I'll end with that there. But the other issue is getting people either pink slip from the jail out to NOPH, or getting people when they're found incompetent and restorable, they need to either be restored at NOPH if it's a violent misdemeanor, and that's not getting done in a timely fashion, or if it's a nonviolent misdemeanor, there's supposed to be an outpatient competency. And as far as I know, statewide, there isn't any efforts to get that accomplished. So I just want to make sure that that's at the top of your head. And I want to end with a good story. 2 years ago, we had a woman who was in and out of jail treatment, CAD, and Dennis Whaley, who was a Lucas County Sheriff DART officer who now works for Midwest. When he was a DART officer, came to me and said, "Hey, I've got a bed for her at a treatment facility. If you let her out of jail, I'll take her there myself." And I said, "Dennis, she's just going to run." And he said, "Nah, she'll be fine." He wasn't giving me a guarantee, but he thought that she'd follow through on treatment. She got to the treatment facility, threw the pen at the desk, ran out the door screaming, "I don't want to be clean. I don't want to be clean." And she was gone. That was 2 years ago. When we caught her, I sentenced her. She spent some time in jail. Her probation was over. That was 2 years ago. Today, she sent an email to my probation officer saying, "Today is my 8th month anniversary of being sober. I have a healthy 4-month-old boy." So we have success stories. All of you were a part of that success story. We didn't do that. She had treatment. She's in treatment now, not ordered by a court, but I don't know who it's with, but probably somebody who's on the phone here. So we're getting to some people. Keep it up. I thank you all very much.
Thanks, Judge. We'll always appreciate those success stories, and we'll celebrate them when they're brought to us. But we really appreciate that. We have Julie Kukuthi next, and Connie White is on deck.
Good afternoon. I'm Julie Kukuthi. I'm the director of the Inpatient Flower Hospital Psychiatric Department. So I want to thank everyone for this opportunity. I am bringing forward a concern related to the increase in acuity and violence that we're experiencing within the inpatient world. As I can say for myself, it's at Poor Medical Flower Hospital. While the COVID numbers have dropped across the region, incidences of psychosis and acuity of the truly mentally ill has increased from our experience. While we know we are not the only inpatient unit seeing this experience across the area, we are the local facility that is experiencing it. Flower Hospital has a 10-bed psychiatric intensive care unit out of our 74 licensed beds for inpatient. In the past few months, we've had patients waiting almost daily for these beds. The increase in acuity correlates to the decrease to pretty much no ability from what I've witnessed to access beds at the state hospital, and this has led to an increase of episodes of our seclusion and restraint. From a statistics standpoint, from 2018 to 2019, our episodes of seclusion and restraint doubled, and then by 2021, they've tripled from 2018. Please do not believe that this is due to my staff or physicians' inability to care for the patients or the compassion for those psychiatric patients. It has everything to do with the decreased ability to access beds at the state hospital as we were able to in previous years. While I appreciate the judge's comments regarding the forensic or the legal population having access to those beds, from the civil standpoint, this has been a barrier. And we are currently seeing a huge increase in the level of severe mental illness that are coming into the hospitals. We're receiving patients at time that on their emergency application, it was clearly written the patient was too violent for the jail staff. Currently, ProMedica Flower Hospital has the only psychiatric intensive care unit in a 10-county area, to my knowledge. With this increase of patient acuity and severity of illness, we are seeing also, in addition, which we heard from many, an increased length of stay. And that has to do with the difficulty of finding placement and housing for those patients that are so severely mentally ill and truly need that support in the outpatient setting. We're seeing patients running 35 to 45 days, which is stays, which truly decreases our bed availability on top of that. All of the previous concerns have led to an increase in patients waiting in the emergency rooms for beds. 2 to 5 patients a day on average are waiting in the morning for us to have beds for them. This morning it was 8. And they're waiting across many emergency departments waiting. It's not just the adult population, it's also the kids. There's many numerous kids that are waiting for beds in the inpatient settings also. This in addition correlates to another issue of trying to hire staff. Although we've recently made progress for hiring mental health professionals and mental health assistants, which is our employees that do the every 15-minute rounding for safety, we're still having great difficulty in hiring RNs. Our ask is to request any assistance that may be available to us as part of the community continuum of patient care, whether that assistance could be some type of potential funding for resources, additional education for our staff in caring for the most mentally ill. It is becoming more and more of a struggle and a safety concern for staff regarding the ability to not be hurt or injured in dealing with these challenging and sometimes difficult behaviors that accompany an acute inpatient mental illness crisis. We've invested in some trainings and support for our staff, but we're asking, is there anything more out there at the county or state level that maybe we are unaware of? And so thank you for your time today and this opportunity to request any assistance for the safety of the patients and our staff.
Thank you, Julie. We really appreciate the work that you do and your comments. We're going to move on to our next speaker, Connie. Good to see you, Connie. I haven't seen you in a while, maybe pre-pandemic.
Yes.
Joe Habib is on deck. Connie, go ahead.
Good afternoon, everyone. My name is Connie White, and I'm the Executive Director at Sylvania Prevention Alliance, formerly Sylvania Community Action Team. Thank you for the time to come today to the board and to present to you about the need we have seen in our Sylvania community to better support children and youth in our area. About 7 years ago, our previous director, Deb Cheney, started researching a program called Life of an Athlete. This program is a science-backed program that gives students hands-on practical application knowledge to make healthy choices for the betterment of themselves, their school, and the community. We realized we wanted to reach a different type of student that may not have felt drawn to our other youth programming. We noticed we were missing student athletes and those involved in performance-based extracurriculars and wanted a way to connect with them, to speak with them about prevention education in a way that would identify to them. We realize a benefit of a program like this to the students of Sylvania who are already heavily involved in extracurriculars. So we decided to establish this into our youth programming, and the Core Committed program was born in 2017. We hit the ground running in 2018 and established youth groups at both Southview and Northview High School. We made connections with athletic directors, principals, and coaches who began to embrace the program. We started out small but mighty as word spread and student participation slowly grew. Sylvania Prevention Alliance realized how important this program was. Students began to give testimonials about how Core Committed helped them with important topics that we were addressing with them, such as leadership, sleep, nutrition, substance misuse, vaping, marijuana, mindset, how to deal with stress, and overall good physical and, of course, mental health. The core committed program was helping create a culture of excellence and student leadership among the students in Sylvania to become the best versions of themselves. Some of the topics I described above were not new topics. I was the youth coordinator leading our youth programs, and we were addressing these things, but they were being presented in a new way to appeal to a different group of students. In being collaborative and innovative, we were able to assist students and their families with this new prevention messaging. During the 2020-2021 school year, we decided that we needed to reach out to more students at a younger age, and our board of directors decided that we would take the program to the 3 Sylvania middle schools. We have seen a benefit in having junior high programming in our existing youth programming. So to start for this current year, school year, we brought on new staff to run the middle school core committed program. To date, this school year alone, we have already met with 272 high school students through this program and 255 middle school students, and their school year is not over yet. These numbers prove to us that this program continues to be needed and is benefiting the youth in our community. For the last 6 years, Sylvania Prevention Alliance has funded the core committed program privately. As you can imagine, due to the continued growth and benefits of the program, the additional need of staff hours, and the continued program budget to function, this has pressed deeper into our private SPA budget. The Sylvania Prevention Alliance Board and I would like to find a way to continue funding the core committed program so that we can bring this prevention education messaging to our students. We currently have 2 part-time staff members working a combined of 4.5 hours a week. And we have a program expense budget of $3,100 with a total expense of $6,168 for the fiscal year for the program.
Ms. White, you have 1 minute.
2 of those 14.5 hours that I just described were added this year alone to meet the basic needs of this program. We come to you today to let you know about that in our youth prevention. Good job funding and establishing this program as a success up to this point. However, it has continued to put stress on our budget. To continue to remain fiscally responsible, we are looking for partial or total funding of the core committed program. We feel that there's a need in our community for a program like this, and we're asking for support in this endeavor to continue to bring this program to our youth without a diminished capacity. The SPA staff and board of directors know how important it is to the mental health board to continue to provide prevention, education, and messaging to our local communities and reaching new students. As a continued partner of the Mental Health Board, SPA is extremely grateful for the continued support and partnership to help make Sylvania a safe and healthy community through education, awareness, and support. Thank you very much for your time today to present to all of you. We do really appreciate it.
Thanks, Connie. We appreciate your comments. We have Joe Habib next, and Michael Hart is on deck. Joe, go ahead.
All right. Thank you, everyone, for this opportunity to address the board. My name is Joe Habib. I am the director of St. Paul's Community Center. In my 5 minutes, I want to talk about 2 things. One, the gaps in services that we see, and staffing. First, let me start with the gaps of services, and we have noticed about 4 of them. The first one is an increase in individuals who need nursing home type care and placement. In the last year, we had about 10 to 15 of them who ended up at our doorsteps, but we are not quite equipped to assist them. I myself ran into a gentleman in the middle of 13th Street standing and needing help. He couldn't even cross the street without assistance. Come to find out, he was dropped off here to St. Paul's by a taxi cab. Well, people like this gentleman need a level of care more than what a shelter can provide. So the question to us is, what is it that we can do about individuals like them who need physical assistance? That's the question for us. And moving on to the second gap, we have noticed a good number of individuals who have mental health issues, but they don't go to a mental health agency. And without that connection, we can't get them a housing impairment form. And with severe and persistent mental illness that they have with no income, there aren't a whole lot of places they can go to. Now, keep in mind, nobody wants to do that assessment, wants to assess them unless they are their clients. So what we need here is someone who is willing to complete the assessment, a one-time assessment, and then complete the housing impairment form so we can put them on a housing track, on a permanent supportive housing track. Now, the third one, we have noticed an increase in individuals who are violent. And by violent, I mean they already acted out against us, the staff, or other residents. Now, typically we call the police. We don't want to put them out necessarily. We want to continue servicing them. But the police comes and these clients are already gone. But they always come back, and we continue to have this relationship to where they're violent, we're afraid of them, and so on. We almost need here like an ACT team to help them get either stabilized or get on a housing track. The fourth gap, and especially we see this in the summertime, we find an increase in individuals who don't want a shelter bed necessarily, yet they prefer to camp across the street from us. Now, we do outreaches. These individuals come to us, they eat, they use our bathroom, they use us as a respite facility, but they don't want necessarily any help. And we can't ask them to move on. Really, we're kind of stuck. We almost feel like we need a team consisting of the police and a social worker so we can help them along, either get housing, access services, and so on. Now, the second thing I want to address is staffing. Let me talk about this here for a minute. Our residential specialists, and these are the people who monitor the shelter after hours on weekends and the holidays, we start them at barely above minimum. It's almost impossible to find qualified staff for that wage. Now, if we find them and we hire them, they typically don't stay. We constantly have to hire new people and train them again, and that's exhausting financially. Now, keep in mind that we're open 24/7. So even if we increase 50 cents or $1 an hour, that's a huge expense for us. Now, we have recognized all these gaps. We recognize the challenges. And as we are looking towards the future, hopefully, we like to provide for solutions for them. And that concludes my presentation. Thank you so much for this opportunity.
Thanks, Joe. Appreciate your comments. We look forward to working with you to find some solutions. I know we've talked quite a bit, so I'm sure we'll get on that too. Hey, okay, so next we have Michael Hart, and on deck, Wendy Huntley. Michael?
Hello, everyone, and thank you for having me. I'm Michael Hart. I'm the Executive Director of the Toledo-Lucas County Homelessness Board. So you're probably going to think I am stealing all my remarks from Lynette and Judge Coleman and Joe, but just a quick moment to reflect. When I came to this community, I had been working in Columbus for a short time, and I came to this community, and one of the first people I met, ancillary to the homeless system, other than my boss at the time, was Scott Silak in 2017. And shortly after that, I went on a trip with a group of community stakeholders to Milwaukee to learn about a model called Housing First. And so, as you all are aware, that was the beginning of what amounted to really a 5-year journey to bring us to a much better space in terms of the status and the strength of our local continuum of care for the homeless service providers. Scott and the Mental Health Board, Senna, as your chair, have been instrumental partners in engaging the homeless system, recognizing that there are undeniable intersections between the spaces and the missions that we all have, and really led an effort to implement Housing First as a model throughout the system. Of course, we had providers such as MPI and others who have been doing Housing First for a long time, but we saw a need to have this type of programming that focuses on those who are chronically homeless and with co-occurring disabling conditions, severe and persistent mental illness, often those who have the highest service needs, and really make sure we're coordinating our resources to provide that critical piece of housing stability. Somebody mentioned earlier, if you don't have the housing stability, a lot of this other treatment is hard to complete. That program led to an allocation from vouchers from the Housing Authority, and the Mental Health Board, of course, funded a program to operate and utilize those vouchers through a scattered site model of permanent supportive housing with Unison. That model has proven to be extremely successful, and Unison, in my opinion, really follows a wonderful fidelity model in terms of meeting all the requirements and tenets of Housing First and permanent supportive housing. And now we have increased the allocation of those vouchers for that very vital population that we must serve to 65 vouchers and maintain a utilization rate of 95% or higher. We anticipate the Housing Authority will increase that allocation. So that's just an example without a lot of the detail of what can happen when different systems coordinate, work together, identify where we have intersections. That effort really was a springboard to rejuvenate, revamp, and reform the local continuum of care as far as the homeless response system is concerned. We just announced to our board today that we've seen a dramatic increase in funding, reversing a negative course that the COC was on, and all of this partnership plays into that.
Mr. Hart, you have 1 minute.
Okay, I'll go quick. I talk a lot. They all know it. In terms of opportunities, you can shut me up if you want, but in terms of opportunities, I think there's more work to be done to integrate our two systems. We have different funders, different compliance issues. We have folks who work with individuals in the mental health space who have housing issues, and people who are homeless who have mental health issues. And so how can we bring our systems together so it can be more seamless? And then just generally the expansion of permanent supportive housing, both through housing development, but also through that scattered site model, and increasing the amount of case management in our system. And then finally, I'll shut up. Of course, as everybody else has said, bringing some leveling to salaries between different agencies and ensuring that the people who are doing this very difficult work are paid well and paid the way they deserve to be paid. Senna predicted that I was going to go overboard when I talked to her last week, and I proved her right, but that's all I got.
Oh, thanks, Michael. Appreciate your comments. We do have to move on. Ms. Huntley is up next, and Judge Stacy Cook is on deck. Wendy?
Thank you. Thanks, Scott. I'm Wendy Huntley, the president of Connecting Kids to Meals, and our mission is to make sure that we provide healthy meals to kids at no cost. And these are at-risk kids that are located in low-income and underserved areas of our community. We do this by really partnering. And so we partner with our Boys and Girls Clubs, our schools, our after-school programs, our summer sites. We partner with community centers, churches, you name it. Wherever kids are gathering, we want to make sure that they have the healthy meals that they need in order to fully engage in the educational enrichment and wonderful fun activities that are being presented. We're the largest provider of healthy meals to kids during out of school time. And we have a number of challenges. We run two primary programs. Our first is our after school meal program. We're in the midst of that now. Happens during our academic year. We're providing about 2,000 meals a day to kids. And then we ramp up in the summertime to provide anywhere between 6,000 and 7,000 meals per day to kids. We do weekday meals and we also do weekend meals. And last year we provided about 776,000 meals. So when we talk about the challenges that our organization and our community actually are facing, it's really food insecurity. This is a significant issue for families. It's a significant issue for kids. Kids are going to have academic, behavioral, emotional, and health-related issues when they don't have access to healthy meals on a regular basis. Some stats for you. 1 out of every 4 kids in Lucas County faces hunger. 40% of our kids in Toledo live in poverty, and over 60,000 kids qualify for free and reduced meals at school. So when school's out, whether it's after school hours or the summer months, they really struggle and become much more vulnerable. And it increases the level of stress on kids because they don't know where their next meal is coming from, or even if they're going to get a next meal. So some of the trending issues right now, obviously, inflation. It's hitting us all, but it's also hitting our organization. And we're also experiencing fuel and food increased costs, food supply shortages. We're ordering now 45 days out as opposed to 1 week out a year or so ago. And the needs are increasing, right? Efforts are increasing. We know that folks are going to try and roll out this summer to try and make sure the kids have fun things that they can do. And so we want to be wherever kids are. And so, our need to be in all of those places has increased. And there was an additional food provider that did what we do that ceased business at the end of 2021. So we've started absorbing those additional sites and meals being provided to kids. So first, I want to thank, Scott and the board and Senna, for the past support that we've gotten to help us feed kids. A couple of areas where I think that we really could use some support. Number one, training. My staff is out there serving meals most of the time outside at anywhere from 150 to 160 sites around the region in the summer months. And they could use some tools to actually deal with parents who are angry. They want meals. We only provide meals to kids. Adults who come up to our sites that want meals, we try to redirect them and let them know about other resources, but some tools and training would be really helpful. And then, of course, resources would be helpful to help us fill that gap. We are running federal child nutrition programs, so we do receive reimbursement dollars, but they're not enough to cover the cost of the meals. And so that gap is growing wider every day with the increased inflationary food costs and fuel costs. So any opportunities to support this work means that you're really putting healthy meals right into the hands of kids that need them the most. So thank you again for this opportunity to just share a little bit about connecting kids to meals and some of the things that we're facing.
Thanks, Wendy. We appreciate hearing about your organization and how your needs have grown. For those of you on the board, I believe Connecting Kids to Meals got a mini grant, I think, was it last year? 2 years ago now, right? And that serves as an example of the types of agencies that our mini grant process connects with. So we really appreciate the work you're doing, Wendy. Next on our speakers list is Judge Stacy Cook, and Sean McNulty is on deck. Judge?
Thank you. Hello, everyone. I feel like I'm at the Olympics of caregivers right now to see all of you. And it's as much of a learning experience to listen to you all, because there's so many layers to what you do. And we really only see some surface results, but it's so much more involved. So I want to thank all of you, not only the board for right now kind of feeling like the Pope as you give out blessings for all that they need, but for everywhere that you're trying to stretch these minimal dollars, which I think you could probably spend 10 times over, if not more, for everybody. So your work has been phenomenal. The increase of services and what you've been able to do over the course of the last few years, and as insurance has kind of opened up with some of the Affordable Care Act that gave us better access to people that were normally ignored. I'm appreciative of what you've done. So take none of this as any negative. I'm going to echo Judge Kuhlman's concerns with regard to how we're working with the NOPH reports and being able to get our severely mentally ill that for us are sometimes needing hospitalization, and we can't make that connection. And that's just something that has increased. And these are people that need hospitalization. And then that next layer of people that are most seriously ill but not hospitalizable. We know that they need serious help, but trying to get them connected with you, we're very quickly handing your services a hot mess, and we're trying to get you up to speed while it's already running. So I know that's difficult. And what I think would be best for us in the courthouses, all of us, juvenile court up through common pleas court, is if we had some consistency to how we utilized your services, because we go to different meetings and we hear about what you have, and then we try to bring it back to our courthouses, but you may find that you have 10 different ways that somebody's making a referral, or different probation officers know one thing. If we could maybe work, not in this type of a setting, but consistently get a way for us to properly refer to your agencies for the best connectivity instead of dancing to our words that may not be in perfect link to what you guys can actually do, because it's what we might perceive somebody could do based on another conversation. So sometimes I think people react to a judge's order as if it's like there's going to be a punishment on the other end. And it really just may be a situation where we've worded something differently because this is how they told us to word it for Unison, but this is how Zeph wants it worded. And if we could give you guys a break by having some consistency in how we connect to your services, I think it would be important for us to figure out how to best utilize and streamline it. One of the things that I've thought of that would save some of your providers and maybe take a burden off of some of your workers would be the amount of times that our probation officers maybe have to interrupt your treatment providers to get updates on where people are in their treatment or if they're in compliance so that they can show that they're in compliance for community control. I don't know if this is something that's ever been discussed, but if there could be possibly an easy portal that a probation officer could just enter, that all the information needs to say is compliant in treatment and compliant in screens. And we don't ever need to know what you talk about in treatment, but that would stop some of the interruptions you all have when you have POs calling and trying to get, if we've got 50 POs and they're calling on 250 cases a week, you're being interrupted a lot at all of your different agencies. But if that treatment provider just enters into a code, the compliance in testing and compliance in treatment, I would think our POs could possibly not have to interrupt you. In addition, the consistency of a release of information, it seems like we might have all kinds of different releases of information for different places, and they go inaccurate or not valid, I think, after certain periods of time. If there was a way that we could have a release of information that stays in place so that we could get information instead of having it, I guess it wears off. I don't know if it's 6 months that you need them done, but I see routinely in the PO's notes that they can't get information because the release of information isn't updated, or we think we have a release and we don't have the right one for you. So if we could consistently get that information and streamline it. So I think my goal would be piggyback on Judge Coleman on, a better ability for us to get the NOPH reports and connectivity, and also streamline how we utilize you all. You have great programs and phenomenal work being done. How do we best utilize you without creating a burden and some consistency in streamlining it for you so we don't interrupt you all the time? So that would be ways that I think we might be able to help some of the burden on your officers, so or your different agency providers. So hopefully, I think I'm got in under 5. Hopefully, Morgan.
You got 30 seconds. So.
Oh God, I can come up with more. So, but again, the mental health connectivity, I have 3 guys that have been lifelong mental health street and institutionalized. We finally were working with injectables, and I'm going to knock on some wood because these guys have phenomenal quality of life, have not been in and out of this system for arrest over the last year. And I'm talking, these guys have had 20 years of nonstop arrest. So they became med compliant with the injectable shots, and they love their treatment providers. Did I eat it up, Morgan? All right. Thanks, guys.
Thanks, Judge. Appreciate your
you.
comments. Great suggestions as well.
Thank you.
Our next presenter is Sean McNulty, and I'm going to deviate from the schedule a bit, and Tina Butts is going to be on deck. Sean?
Okay, hi Scott. This is actually Dan Huseman with the Opportunity Project. Sean is actually unable to attend. I apologize. I did try to send a direct message to give you a heads up. So I'll be just kind of going over things really quick. My name is Daniel Huseman. I work for Toledo Legal Aid Society with the Opportunity Project. And first, I'd like to take a moment to thank everybody here for all the work that you do. It's so critical. We're working with individuals with complex and changing needs, and everyone does such a fantastic job. And all the staff that aren't even here that do a lot of the direct supports and all the agencies and partners that we work with. It's fantastic being in this field and getting to work with all these great people. Most of all, the individuals themselves. So to our project, we started, it's actually, again, Sean's really his vision to try to bring additional supports and have the public defender's office look at things in a more holistic way. And that's really kind of what the Opportunity Project was born out of, trying to look into things and find individuals that may have either mental health and or substance use related needs, as well as housing in other areas, and try to provide some early supports to them, because we know that the earlier we can get involved and really help people. If we can prevent things, that's always the best thing. But if we can get in early and intervene, that's going to be the thing that's going to help the most. So that's what we've been doing out of Courtroom 3 for since 2018, January 2018. And continue to do that. We've expanded into several areas. And I think just to kind of keep things short, I'll kind of focus on some of the areas that we've seen that are areas of concern, or the things that we're trying to work in and work through. These things would be like access to services and treatment, is particularly while in custody. So we will try to work to coordinate and with agencies when people are currently linked, and connect them when they're not. But one of the areas that still kind of, I think, lags behind is medications and things like that, and access in the jail. I know there's programs and things that we're doing to try to address that, but that is definitely an issue that still is present, and one of the places for people that are coming back regularly to try to at least maybe start getting stabilized to some extent. And I think that echoes into some of the other things that the judges have brought up as well. And that's going to be the competency pieces of referrals and the time that stuff takes, that it's become a protracted process, both in the evaluation and restoration sides. And it's due to a lot of factors. And I think all of those points have really been hit on, so I'm not going to add to that in any way. Housing and placement is still a critical issue. Especially for some of these individuals. I think many people that have spoken so far have mentioned this, but they've also talked, I think, Joe, you mentioned from St. Paul's, the difficulty of working with some of these clients that they've really complex needs, and trying to find ways to get them into more long-term housing, and also addressing short-term options to get them out of custody and into somewhere safe, so that we can start getting them linked with treatment agencies and doing the outpatient kind of work that is going to really benefit them in the long term, building those supports and being a part of the community again, which is really critical. So I think what I've seen is we definitely have success when we're dealing with individuals with comorbid, like especially with substance use related, is either primary or it's highly involved in the individual. Well, there's different residential and sober living placement options that help those individuals. And those we're accessing and working with a variety of partners. All the agencies have been great to do these kinds of things, but we're still running into issues when mental health is the primary need. The last thing is just some of the things we're seeing more recently. It's been, I think, an ongoing issue, but the revolving multi-system individuals who just kind of keep coming back into custody, and we can't really get them any traction in the community and following through. And I think the court's really starting to notice those sorts of things going on. And feeling that impact. So I think those are things that we see happening, and what we can do, whatever we can do to be part of that solution. We want to, we continually, I'd like to say a positive thing. One thing that was really appreciated just to happen today, I was talking with the wife of an individual we were working with, and just the amount of what she has impacted trying to help keep this person's job intact while they're staying in custody, and the efforts that she has made to make sure that he can get connected. He's not been linked with services before, so this is all new to her. She's made such an effort to try to really learn more about what's going on and how she can best support her husband with his current needs and what's happening. And we're currently in process with it. But that's why these things and the stuff that everyone here does is so critical, because we really help the individuals and all those people that they impact and are affected by their lives. So I think with that, I'll just kind of let it, but I appreciate the time, and thank you everyone for all the work you do.
Thanks, Dan. Appreciate your comments. Let Sean know we miss him.
Most certainly, he's much more than I am.
Yeah, if he's got anything he wants to send me, have him feel free. Tina, are you available? I see you're off camera.
I'm here, Scott.
Go ahead, you're next, and then we'll have Kelsey De Pompey on deck.
Okay, and first of all, I want to thank everybody. You know, I'm coming from a different perspective. You know, I have family members that suffer from mental illness. And throughout the courses of the years, I have been really hands-on. But as I go through challenges with them, it seems to get harder and harder for them to really get the care and the help that they need. And it's really frustrating because if I'm standing here with them and going through different difficulties with them as a family member, I can only imagine what someone's going through when no one's being a voice for them. You know, I have the ability to pick up the phone. And I mean, Scott, you and Amy have been just fantastic, you know, and I appreciate the fact that you came over, we sat down, and some of the things that you wasn't aware, you know, I mean, just for instance, you know, how the hospital are treating some of the patients and some of the, sorry about that, and some of the ACT team, they take patients out there and they being disrespected. And I mean, and then you try to talk to the doctors and, you know, it's just like going in one ear and out another ear. And it's very frustrating for me. And I hear a lot of people talking today on the phone. I know there's lack of funding. I know there's some things, but I feel that at this point that we need to get a community, a tag team together and try to fight to whoever we need to go in front of to make sure that, because it seems to me the mental health voices are not being heard, only to a point that they get some treatment, but no follow-up. You know, there's no groups, there's no anything. And I'll say, where is a treatment plans? What do you have? What's in place? And there's nothing. Everybody just seems to me to say, oh, everything's fine. The reports go all the way up the channel. Everything's picture perfect, but all the resources and everything that is supposed to be there and provided for mental health are now leaving, just like the law passed that the hospital, NOPH, they won't take clients out there to get them stable enough for society, but they're willing to take people that's awaiting to be competent for different criminal cases. So my thing is, what do they have to do? Commit a crime to be able to go into the hospital to get treatment? You know, it just don't make sense to me. It's backwards. And just to go up and down the streets and see people just out here, and then you call different agencies for help and they tell you to call the police. Well, sir, they have not committed a crime. Then they mess around and get charged with disorderly conduct, intoxication, no alcohol in their system whatsoever. They get caught up in the system. Then when they do go for housing, their records are damaged. Then it's just dismissed, but it's still on there. So, I mean, it to me is just so frustrating. And it was like a breath of fresh air. You know, I know Amy, me and her have talked on the phone for hours for the last couple of weeks, trying to get things in place. And, you know, me and Scott, we have sat down for 3 hours. And my thing is this, some things to me that people don't share of really what's taking place out here with the mental health. People out here, it seems like to me, a lot of things are going over to the opiate, to the drugs, you know, and I'm gonna just be very candid. You can build more, you can get more money, I don't know where or how to turn and just be out here kicking and screaming and hollering. So, you know, some of the hospitals to me,
Tina, you got 1 minute, I'm sorry.
Okay, no problem. When your family's already going through emotional things, if you got these degrees, you should some kind of way be considerate the feelings and, different things like that. So, I'm just looking to be a part of something to make and be the voice for the mental health illness. If we have to go all the way to the top, where they have to be more resources, put other issues on the ballot, raise more money, do whatever it takes for us to do to help our people out here. Thank you. Did I use my time up?
You still have
No.
30 seconds.
Yeah, like, okay, this lady about to cut me off right now. So, I mean, I'm good. So,
Thanks, Tina. I was just messing with you. That's me doing a test just to mess with you because
is that
you
you?
seem to be a very
Okay.
important person today. Tina and I
I'm
and Amy have
sorry.
spent a lot of time talking over the last couple of weeks.
A lot.
And really gathered a lot of insight into her experience of trying to negotiate our system. And her experiences is tracking along lines with a lot of the comments that are being made by the provider side and the judges as well. So I really appreciate your comments, Tina. And of course,
Thank you.
we'll continue to work.
Thank you.
Our next speaker is Kelsey De Pompey of Springfield Middle School, and Patricia Robb Patty is on deck. Kelsey.
Hello, everyone. Sorry I was late. I was having technical difficulties. My children had hidden my charger from my laptop, so I was having a hard time getting logged in. So I apologize for that. So with my experience, I have been in education now for 12 years, with 9 of those years being a school counselor. And I have worked, all over the state in some of the most high needs areas, with a lot of just at-risk populations in particular. So within the last couple of years, especially due to the COVID pandemic, there's definitely been, it's unlike anything I've seen in a very long time, increased symptoms of things like ADHD, aggression, anxiety, depression, suicidal ideation, self-harm. It's almost a regular occurrence in our counseling offices that we are dealing with. And through my professional network of other school counselors, I know that Springfield is not even close to alone in experiencing these issues. So some of the things that we've kind of come up against when trying to combat these issues and help these children, there's just not enough crisis facilities for children under a certain age, specifically under the age of 16. So when we have children who are, 11, 12, 13, 14, even younger in the elementary levels, we have a really difficult time trying to figure out where to help them go. And other issues with that are the high wait lists for getting treatment, or being able to be seen regularly by the same counselor. I've had students who have had mental health counselors and, due to some turnover rate, which we're all mental health professionals, we're all burned out at this point because it's just been very overwhelming the last few years. So that's nobody's fault in particular, but I know for children who really need that consistency and that routine, having to start over again is very intimidating for them, even more so than, dealing with those dark thoughts that they deal with in the first place, because they don't want to have to relive that trauma. So we also have had an increase in our low income population, and the issues too with COVID, with trying to replace in-person counseling. And again, at nobody's fault, there was some things that were unavoidable, but the in-person counseling versus the online counseling, I have a lot of children who come from home situations that, while they may not be abusive, they're not always the most stable. So it's very difficult for them to try to participate in online counseling when they're in a home where they don't have a private space where they feel like they can be truly open and honest with that counselor through a screen. But again, hopefully that's something that's going to be not necessarily a thing of the past, but not something that has to be the preferred method. So some of the other things that I'm noticing too, the school-based services that we do have access to are only accepting Medicaid eligible patients. And while we do have a high population of families that live in poverty, we have a hard time getting that paperwork back. And I think a lot of times it's because we have single parent households or children that are living with other family members that aren't living with their parents at all. And maybe these family members aren't really sure about how to do this paperwork, or they're embarrassed to ask for help. You know, and as a school system, there's more and more pressure falling on us to solve a lot of these problems. And there's just not enough manpower and not enough time in the day to handle all of that on our own. In addition to that, I know a lot of families are very hesitant about using medication for their children who may potentially need it. And a lot of times that has to do not necessarily with the stigma of taking medication, but the cost of medication. So I think some things that could really benefit the schools is having a comprehensive list of providers that will service children of certain ages. And kind of streamlining that. Because the other thing that gets kind of sticky too is, you know, as a school system, we can't necessarily make a direct referral because then we could be financially liable for it. And schools are struggling financially as it is. So that's always something that school counselors tend to struggle with. And we always try to say, you know, start with your pediatrician, start with your child psychiatrist or their doctor.
Kelsey, you have 1 minute.
Okay, sorry. I like try to cut out notes too. So if there was something that schools could be provided with, essentially like a list of resources that were directly related to youth, from the elementary all the way up to the high school level, I think that would help us out a lot and also help us connect with these families. In terms of our transient population, our low income population, and that sort of thing, or families that just don't know enough about mental health in general. I think having something tangible that we could give them to have more information available, and something for us as counselors to have readily available to know who to contact when we need it would be really helpful. Gosh, I'm so sorry. I had so much stuff written down too. So thank you. I appreciate the time I got.
Thanks, Kelsey. Again, if you want to send me some of your written comments, we can certainly integrate them into the record.
Okay, thank you so much.
That goes for everyone. If you have some written comments that you'd like to send, I did put my email in the chat. I'll do it again. But also at this time, before we move to our next speaker, I wanted to just make note that if there is anybody else who wasn't on the list that would like to speak, now would be a good time for you to go ahead and raise your hand, and we'll start documenting who those folks will be, and we'll get you on at the end. Now that's raise your hand in the reactions function, Miss Conlon. Or you could just come over, Carol. All right, so we'll go ahead. Miss Robb, you are our next speaker, and Dr. Sean Ryan is on deck. Okay.
Thanks, Scott. Can you all hear me pretty well? All right. Thanks for this opportunity for us to participate. The Thomas M. Werner Center is a peer-driven organization that provides a safe and welcoming campus for those living with mental illness to socialize with peers and obtain mental health and wellness opportunities. In fact, many of our members are clients of those of you who've already spoken. I won't repeat. I mean, you all hit on many of the things that we face. Since the pandemic, we're witnessing a real decline in our members' mental health status. Many feel the system's moving too slow for them, and a lot of them have experienced caseworker turnover, which can be unsettling. We have a lot of our members returning. We're back to drop-in status, so we're not, scheduling people like we were. And there are still some, however, who are out there who are reluctant to come back and who are isolating themselves. We're trying to manage both in-person and virtual programming, but we really don't have enough staff to fully support both of those. As our members are returning, things are getting busier. Our trending issues for us related to staff are low wages like other people, but also we're seeing a lack of available male workers and workers of color who may be able to better help us connect to the disenfranchised communities that we're trying to connect with. Transportation is tough. We have 3 vehicles. However, a lot of our members use cabs, and with the lack of workers out there, the cabs are 2-3 hours behind. We're sitting here at 5 and 6 o'clock waiting for cabs to pick people up. We're trying to get people home ourselves. That's been a little bit of a challenge for us. We almost have to start calling the cabs at 1 in the afternoon to get them here by the end of the day. Some of the barriers we face are the technology gap. If we ever end up back in a situation where people are confined to their homes, we're going to have a real hard time connecting with people. We have all along, but it seems like it's gotten harder. And then finally, as a non-clinical agency, we struggle with CHCs who do not recognize us as a place where they can release information. So oftentimes people come without enough information for us about a potential member so that we can best serve them. So that's what we have. And of course, we agree with a lot of what other people have said. And we also appreciate everything that the Mental Health Board has done for us. So thank you, Scott.
Certainly appreciate your efforts, Patty, and we're glad to hear that you're now open for drop-ins. We value the Warner Center and the work you guys do with supporting individuals, and I'd like to hear a little bit more, maybe when you get some time, about the individuals who are yet to come back because of the fear of the pandemic.
Okay. We're still making pretty frequent wellness calls along with along with our in-person work. So
thank you, Patty. Our next speaker is Dr. Sean Ryan, and then we have Carol Conlon on deck. Dr. Sean?
Thank you, Scott. Appreciate the opportunity to speak today. For those of you who don't know me, my name is Dr. Sean Ryan. I'm the President and Chief Medical Officer of Brightview Health, which is a fairly large provider of mental health and addiction services throughout Ohio, including a lot of areas in Northern Ohio, specifically Lucas County. I'm talking to you today about some of the issues going on. I absolutely understand folks and all the echoing of COVID crises exacerbating mental health and addiction. I'm happy to say we've continued to serve over the past 2 years. It's hard to believe that COVID's been going on that long. Hundreds of clients in Lucas County area to the tune of hundreds of thousands of dollars of unreimbursed care because we have a commitment to seeing anyone, anytime, anywhere that we can. And that includes a very robust system of never having a wait list for those services, which is, I think, fairly unique. We are committed to our communities. Brightview Health has never even one time closed the community treatment center because that has been a strategy that we've undertaken over the past several years as we've striven to serve those towns and cities that we're a part of. But like all others, we have continuous and rising costs. It's complicated and fairly expensive to provide robust mental health and addiction services with, as I stated, no waiting list. And through folks like myself, I'm board certified in both emergency medicine and addiction medicine. And I'm here today to humbly request the board's consideration to take a look at some data we can submit on the indigent patient services that we are providing in the county and often from folks around in and out of the county because we don't really have any barriers to entry to treatment. Whether anyone, wherever they're coming from, we will see anyone basically anytime, anywhere, like I said. Now, that's been our mission since I opened the first office in Norwood in the middle of Cincinnati, where the reason we didn't have any wait list for the first year was because I saw every one of the patients. So that was we've moved on from that strategy and thank gosh have a really amazing staff providing these high quality services of holistic medical, psychological, and social services to our clients. Happy to answer any questions. I did want to make note to some of the judges' questions, which were good ones. One of the things that Brightview has done over the years has committed to barrier reduction insofar as communication with our criminal justice partners. We have a very significant system in place to do answer some of the questions that she raised. And those are, real issues on both sides of the house for the community mental health and addiction partners and the criminal justice. So happy to talk to you about that offline. I just finish my time today by saying appreciate the time for discussion. Like I said, Brightview is committed to staying in the community and should be there and potentially growing services as the mental health and addiction needs have unfortunately catapulted, as I predicted a couple of years ago when COVID really struck, because what we've seen is community members have basically every negative criteria that could possibly occur. If they had mental health and addiction, it got worse with COVID. And we've seen that. I've seen it in my own patients because I still see them in Cincinnati, Ohio. Thank you for your time today. Thank you, Scott, for the opportunity to talk, and I appreciate the hearing us out on this issue.
Thank you, Dr. Ryan. We really appreciate you joining us today. And thank you for your patience being towards the end of the line.
No problem at all.
We have two more speakers. Carol Conlon is our next speaker, and then we have Andrea Smith. And if there isn't anybody else, Andrea will be our last speaker. So Carol.
There we go. Hello, everyone. Thank you for including me today. And Scott, I have 4 things noted that I had passed on to you. I could really do them in any particular order, but I will start those 4 at the beginning, and I'll be brief. As the executive director and the attorney here at the Lucas County Guardianship Services Board, I want to let all of you know, because many of you I haven't had a chance to speak to yet, so I wanted to be sure to try to have the chance today, that we remain fully open now for referrals of Mental Health Recovery Services Board connected individuals. But I have to be honest, referrals into our agency are very slow going. It could be that many of you just don't know that we exist yet. You haven't gotten a chance to be part of a Zoom call with us on referral packet training or whatnot. At the very moment, I have no referrals coming in from any of your connected agencies. So I want to tell you that I want to assist you with any barriers to the referral process, whatever they may be, and ask that that Scott, whatever we can do to remind everyone and your connected agency that referrals can be submitted now, and we really encourage them because that we're here to do the work. I have an entire team. It's legal and social services for our guardianship team here at the Lucas County Guardianship Services Board. And I want you to know we're here and we stand ready and willing to assist adult individuals affected by mental illness and substance abuse disorders that require authority to act on their behalf when they are unable to do so. If we could ask for anything else from all of you, it would be a point person, a team leader of sorts for each individual referred to us for guardianship assistance. In a perfect world, we'd have one person we could turn to and say, hey, this is where we're at with the guardianship, and we want to keep you informed and in the loop and keep emailing you updates and where we're at with helping this individual with guardianship. Lastly, and specifically, there's one individual who keeps coming to mind that we are now, he's our ward and we're his guardian, our agency is. He's also homeless and we're working to help him. All avenues for this individual appear to be closed to him on housing due to his past actions, behaviors, or treatment towards staff or others. A place that we can look at housing for him and any future wards of ours that are more like him, with a severe form of mental illness. I don't know how else to refer to him except it's at the severe states. He keeps cycling through the hospital to the streets, hospital to the streets. So he's been extremely difficult to place into housing, and that's been an obstacle for us in his care. So please know if we can find housing for our wards, We intend to do so, and we're working to do so, but certain individuals are just so hard to place. So we are, in closing, we're super involved as guardians. We're working to educate those we work with at the hospitals and elsewhere just how involved we are, and that we're not going to fax in an answer or fax in a signature. We're going to come see you in person, and we're going to visit that person, and we're going to treat them as much as we can like we treat our own family. So thank you for your support of us, for funding us. And please, if any of you have people that need guardianship assistance, we're here. Thank you so much.
Thank you, Carol. You guys have done amazing work. Can you go ahead and put your contact information in the chat for everybody so they can just connect with you directly and maybe learn a little bit more about what you guys are offering right now?
Absolutely. Thank you so much.
Appreciate it. Our last speaker is Andrea Smith. And I'll just make this last call for any other speakers. Go ahead and hit your reaction button, raise your hand, and we'll get you on the list. But Andrea, go ahead.
Well, thanks, Scott. Yeah, I wasn't necessarily planning on sharing, but I'm glad you opened the floor for this opportunity. There's been a lot of really insightful things being shared. One thing, not necessarily from my own personal realm, but in people I work with, along the same lines of what's been shared, a missing link for our youth in our communities is mental health services for children that are in the foster care system. I can get something written up on that. I can't expand any further in it. I just know that there's a gap for that specific population. And having my passions being youth and youth programming, I've had the privilege, and thanks to you guys, in working with some of the best youth programming that I've ever known of, really. And like the example with SWAT and SAC, you know, it's been around for 20 years. My concern for youth programming, especially those that have been proven to be successful, is the summertime. I've seen a lot of progression and growth from students, and then to have a lull in 3 months, especially where we know there's a lot of like domestic violence and things in our community and lack of parental involvement, that lack of consistent programming or support is definitely concerning over that time frame. And then another concern I have is the youth programming. I think most of us, especially in prevention, know Bill Geha. He is amazing and done tremendous things all across Northwest Ohio. Something I've been working very closely with him in the Springfield community. Something probably most people don't know about is that he pays for all of his programming out of pocket. My concern is what's going to happen if something's happened to Bill Geha or his programming. I don't want that momentum to stop. So we have wonderful things going on in Northwest Ohio as far as even prevention services with our youth that I'm very proud to be a part of. I just want to make sure I guess my concerns are keeping the momentum with things we're going and throughout the summer, and continuation of support for things like Bill Geha's extra programming, Project Hope and Project Peace. So we're doing awesome things like with you, Lucas County Mental Health. Like we're so happy. And like I said, we just don't want to stop it in those time gaps that are there. So thanks for letting me share, Scott.
Sure, Andrea, it's good to hear from you again. Really appreciate all the work you do over there. And we do have another speaker that just raised their hand, Cameron Williams. Cameron, it looks like you're going to be our last.
Okay, thank you so much. Like I said, I didn't expect I was going to share either. Hi, everyone. My name is Cameron Williams, and I'm an outreach worker for Oxford House Recovery Housing. We are new to the state of Ohio. I am actually transferring to the state of Ohio from Indiana, where we have a very large established 80 homes throughout the state, which is about 600 beds. We serve both men and women, women with children and men with children. I just kind of wanted to address some barriers that I've heard from our residents and our homes and our communities. We have homes located in Toledo, Dayton, and Cincinnati currently. And, you know, with our organization, we like to address things such as transportation barriers, employment, support meetings, those types of things. I am an individual in long-term recovery, so I know that these barriers can be monumental to individuals trying to achieve long-term sobriety. I know that we were talking, we might have to close one of our homes due to a bus stop being taken out of the community. And now the house isn't as set up for success as what it once was. These are types of barriers that we are experiencing with some of our residents that are extremely monumental to overall success. I'm super excited to get to know everybody on this call and to work with the community. I will be moving to Toledo, Ohio. So I'm super excited from Lafayette and Indianapolis area. So I'm sure I'll be meeting a lot of you. But if you're not sure, we do not discriminate against anybody with criminal histories, anybody that is on MATs, anybody that is, if somebody is willing to be sober and to put an action into their recovery, they are more than welcome to apply. And I will also, again, put my information in the chat box. So if anybody needs anything, we do have a reentry program. I heard that there were some judges and some criminal justice systems on here. And we have an extremely strong 80% success rate when it comes to our criminal justice. So if there's any other questions, you guys may reach out to me anytime. Thank you for letting me share.
Thanks, Cameron. You can go ahead and put your contact information in the chat box too, if you like, so people can bring it down. Oxford House has 5 or 6 homes in Toledo now, right?
Yes, correct. And we are actively looking to expand, most definitely.
Oxford House has come over to a couple of our meetings when we were doing them in person a while back, and appreciate the work that you're doing here. At this point, it seems like we don't have any. Oh, and by the way, welcome to Toledo. We need all the workforce we can get. Come on, bring your friends. I think that's it. I don't see any additional hands up. I'm going to turn it back to our board chair, Ms. Senna Friedman, for closing comments.
Wow. First of all, Cameron, again, let me echo Scott and say welcome to Toledo. We appreciate everything that the Oxford House is doing for our community. I want to take a moment and thank each and every person that's on this call. Thank you. From board trustees to staff to our incredible organizations that we work with and caregivers. Thank you. To take the time out again is a lot to ask for, but you know what? A lot of magic happens. Ideas get sparked when we have these meetings. And so I really appreciate it. Now, everybody just take a deep breath. You've already spoken, it's done, it's over and whatnot. And know that this afternoon, that by you taking the time out, you're helping to shape the future of Lucas County for future generations. It's not a waste of time at all. And know that you've been heard. We hear you and we will process all of your comments and all of your suggestions and everything. So just know you've been heard and take a deep breath and know that you're making a change in Lucas County. Thank you. Thank you so much.
I am mute. Thanks, everybody. We really appreciate all the work that you do each and every day. And with that, we'll go ahead and end the session. Have a good evening, everybody.